Is your child not talking yet? Does your child have a diagnosis, or do you suspect a diagnosis of autism spectrum disorder, a syndrome-related disorder, apraxia of speech, or a speech delay? Is your child nonverbal and medical providers have told you that your child will never talk? If you've answered yes to any of the following questions, then this course is for you. How your child can go from nonverbal to verbal with my step-by-step guidance. Welcome to SpeechWorks by Elissa. I will be taking you on a journey of discovery, growth, and empowerment in the world of speech and language development. My name is Elissa R. Mandel. I'm a certified speech language pathologist and an expert in autism spectrum disorder. I specialize in oral motor placement, motor planning, and auditory processing. I have been successfully guiding parents of nonverbal children to push their children through developmental speech and motor milestones for over 30 years. Autism spectrum disorder, syndrome-related disorders, and other developmental delays can significantly impede a child's speech and language development in such a way that these abilities do not develop fully on their own or with traditional speech language therapy, leaving the child without the ability to communicate. Over the past 30 years, I've been fortunate enough to create an integrated, winning combination of behavioral and therapeutic activities to help families communicate with their loved ones. I have combined every successful therapeutic approach I have learned over the past 30 years to create all of my programs. Many parents who come to me with questions report that their children have attended traditional speech therapy for many weeks or years with limited to no progress in their child's ability to verbally communicate. Many families are unaware of the progressive treatment approaches available today. I bet you're asking yourself right now, what can be done for the child who cannot learn to produce speech movements or process information correctly using traditional speech therapy approaches? By the end of this introductory course, you'll have the answers and a better understanding. I am blessed to be able to make a difference in a person's life using a unique combination which appears to tackle the root cause of the problem for each individual. There are many children who have completed my programs that are even able to catch up to their typical peers. I have found that my unique approach can have a startling and dramatic effect in the development of motor and verbal capabilities in children who once had little or no capability for speech. It differs from traditional speech therapy in that the strategies continue to utilize auditory and visual stimuli while adding the tactile, kinesthetic, and proprioceptive sensory systems. This allows the child to feel the movements as well as hear and see them. Motor planning for speech production is a highly refined and specific series of movements of the tongue, lip, jaw, palate, and muscles for speech breathing that are necessary for intelligible speech. The act of speech begins with an intention to communicate. Next, an idea forms, outlining what the speaker wants to say. The words for the desired message are put in the correct order using correct grammar, and then each word contains a specific sequence of sounds and syllables that must be correctly ordered together, and all of this information is translated from an idea. Then the information is broken down into a sequenced order of sounds and syllables. Play-Doh, which is a series of highly coordinated motor muscle movements. The brain must tell the muscles of these articulators the exact order and timing so that the words in the message are properly pronounced. Finally, the muscles themselves must work properly with enough strength and muscle tone to perform the movements needed for speech. Usually once syllables and words are spoken repeatedly, the motor act becomes automatic and requires less effort.
Hello? 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 Oh, Dad, are you there?
And the child doesn't have to think about how to say the word or phrase anymore. At this point, speech motor plans and programs are stored in the brain and can be quickly accessed and put together effortlessly when they are needed. Helping a child to develop the capability of speech needs to be individualized, and typically there is no short-term quick fix available. For many of the parents I train, children require many years of ongoing work using various techniques and strategies as they progress from the development of one physiological capability to another. I train parents and caregivers to systematically apply techniques at home and not be entirely dependent on routine frequent visit to an office. This makes the process more economical for families. It offers an approach with a more rapid rate of progress in speech development, and it reinforces the positive parent-child bonds that are essential in this effort. I can best describe what I do as developing a physical fitness routine that is largely effective because of the constant reinforcement and the presence of a trainer. In my experience, many nonverbal children will exhibit maladaptive behaviors because of the frustration of not being able to communicate their needs. As some of you may have experienced, some speech-language pathologists will either not treat a nonverbal child because they may not be able to sit, attend, or focus a task, or they don't know how to properly coordinate the muscles to be able to teach them how to talk. Often therapists may highly recommend a picture exchange communication system or an augmentative communication device to teach them how to talk. They learn how to point to a button or exchange a picture to make a request like, "I want pretzels." I'm not opposed to this approach. I think it's an important prerequisite skill. But for me, teaching a child how to point to a button or exchange a picture can be as easy as teaching them how to manipulate all the muscles for verbal speech production. Let's get into it more specifically. There are 6 muscle groups that I teach parents about and how they coordinate. The first muscle group are the muscles for speech breathing. This includes muscles for diaphragmatic breathing and the intercostal muscles for inhalation and exhalation. When you're talking, you can actually feel the streams and pumps of air coming out of your mouth. The second group of muscles that move are the vocal cords. With some sounds, the vocal cords vibrate, and with others, they don't vibrate. So I teach how to communicate the muscles for vocal fold movements on and off. For example, if you say B, the letter B, and you feel the vocal cords, B, you can feel them vibrate. When you say P, the letter P, and you touch your vocal cords, you can feel that it does not vibrate. P. Next muscle group is in the back of the throat. It's in the pharyngeal area. By manipulating these muscles in the back of the throat, this allows the air to go through the nose versus the mouth. For all vowels and most all consonants, the air goes through the mouth. There are only 3 sounds that come out of the nose. They're n, and ing. So if you were to plug your nose and try to say you'll find that you can't produce that sound because the air is coming through the nose. The next 3 muscle groups are the lips, tongue, and the jaw. I find a lot of providers really focus on the lips and the tongue for some reason, maybe from their experience or it's more visual, but the key to getting intelligible speech is targeting the muscles for jaw movement and height. Jaw stability is crucial for intelligible speech. Watch as I say these vowels. E, I, A, A. See how my jaw goes down with a precise jaw height and movement in order to make my vowels intelligible? Now you know how to coordinate muscles for speech, but you should know that if these oral motor muscles are not coordinating for speech, they're typically not coordinating for feeding and drinking as well. And nobody typically looks at that problem. Pediatricians aren't well educated, so unless your child is diagnosed with failure to thrive or is severely underweight, requiring supplements or a G-tube, no professional is going to address or identify a minimal feeding or drinking issue. A child needs to be able to coordinate the muscles for lip, tongue, and jaw in order to eat and drink properly and develop a mature rotary chew. The best example I can give you of what a child feels like when they can't coordinate all of these muscle groups is like trying to drive a manual stick shift. Initially, you have to think about where your hands and feet go, and then after some repetition, your muscle memory starts to improve, and then eventually you're not grinding gears, and you might be singing a song, and you're just driving, and you're not even thinking about where your hands and feet go anymore. So learning how to talk is as easy as learning how to drive. Also, developmentally, a child will learn how to talk through auditory feedback. So they hear their parent holding a ball, say ball, and then they attempt to play around with those muscles we talked about based on what they heard to obtain that muscle coordination. For some children, they can't learn through just auditory feedback. They require physical, tactile, and kinesthetic prompting, and then they can learn better how to coordinate these muscles. So basically, they just have a different learning style needed to coordinate these muscles to acquire verbal speech. And currently, there are so many progressive tools out there that parents and therapists are unaware of. One example is that you can develop coordination for speech breathing, the first muscle we talked about, just using a simple horn hierarchy kit. So just like you go to the gym and you increase weights over time to build muscle, this horn kit is systematically created so that each horn gets harder and harder to blow, which improves speech breathing for verbal speech. And this is such an easy technique for parents to carry over at home. I'm always searching for the most progressive approaches and tools so that parents can get the fastest progress, which I find is a priority for all parents. In my future courses, I'll be reviewing child development and present tricks, tips, techniques, and tools to achieve and meet each speech and motor milestone your child needs. Thank you for choosing SpeechWorks by Elissa. Let's embark on this exciting journey together, step by step, word by word, towards a world of clearer communication and deeper understanding. What are you waiting for? Together, we can get your child talking.